I experienced a miscarriage in 2013
Paula.
at 4 months. So this is so real to me. And 2013, two of my neighbors, we were pregnant at the same time. To date, when I see their children, I remember my baby would have been
that size, that age now.
So it is something that does not go away. It is something that you mourn for a while.
A miscarriage is basically losing a baby, whether it is at 7 weeks, whether it's at 40 weeks. For that woman who's expectant, she knows that I'm carrying a baby.
Yes.
And we can't say as doctors, ako kalikuwa kamimba kadogo. You know, for her, it is not kamimba kadogo, it is a baby.
Yes.
And it's a human being, and we have to approach it that way.
Usikumbuke tissue.
So I'm actually finding it hard to start this episode because every time we are about to begin, Caro throws in something. So I'm just trying to calm myself down so that I can focus on this one. But please. Yeah, so that tells you we have a lot going on even offset that speaks to how natural some of these conversations are. And meaningful, not just to our audience, but impactful even amongst ourselves. Yeah, so welcome yet to another episode of Reproductive Health Conversations. I'm your host, Justus, joined by, of course, Caro, your health coach, and Dr. Kireki Omanwa, very instrumental and helpful in these conversations. So if you're joining us for the first time, make sure you subscribe and check out some of the episodes that we have done before. We've done quite a number now. Yeah, and they are quite a resource. Check them out. And of course, if you can recommend to someone else who you think needs to hear what we are talking about, that would also be very, very helpful. Yeah, so today we are talking about miscarriages, a conversation that for many is spoken in low tones because of the stigma that it comes with, a lot of pressure from society. When a woman gets married especially, the questions start coming. There are people who have the talent to begin to monitor and give you, they set their timers, and then the questions start to come. Some very insensitive.
Not knowing what the other party is going through.
Absolutely.
And Daktari, previously in the other episode, you talked about an incident where a lady was being, almost scolded in church, not knowing that this is someone who had just in 2 weeks before that gone through a miscarriage, So it's a space that unless you're in, you might never fully comprehend the pain that it comes with. Welcome once again.
Thank you.
I want to start from another reaction or feedback from our audience. Even before this conversation, people are already sending in questions about miscarriages because it's something that perhaps as Dr. will be sharing with us that affects quite a number of women. So let me read a few of that. Maybe I'll be reading one, we look at it, and then later on we can consider the rest because there are quite a number. The first one says, I've had quite a handful of problems that I'm no longer strong enough to handle. 4 chemical pregnancies and 1 ectopic pregnancy. To say I'm devastated is the least. My gyna the other day told me the only option for me is IVF, which he says she felt broken. 1, because the money involved, and number 2, she never thought it would be her only option. Let me just read the second one as well. I'm a lady with a history of recurrent miscarriages. My last miscarriage was on 21st of last month. It is the 7th miscarriage. All my miscarriages happen at 7 to 9 weeks. So every time I go to a gynecologist, it always shows the fetus heartbeat stops at 7th or 8th week. The last 2 pregnancies, I preferred working alone, but I still lost. Let me read the last one. It says, are there individuals who miscarried and went on to conceive? What can I use in order to conceive again? It's taking too long for me and I'm giving up.
Wow.
Oh,
So
Quite a bit.
kuna kazi.
Quite a bit. Yeah, and very sad.
yeah.
Very, very sad, because a miscarriage is basically losing a baby. Whether it is at 7 weeks, whether it's at 40 weeks, whether it is at 6 years, it's a baby.
Yes.
For that woman who's expectant, she knows that I'm carrying a baby.
Baby.
Yes.
And we can't say as doctors, ako kalikuwa kamimba kadogo. You know, for her, it is not kamimba kadogo.
baby.
It is a baby.
Yes.
And it's a human being, and we have to approach it that way.
That's very true. And I'm glad that you have said that. I accept the apology on behalf of all the other doctors who have told a woman in one way or the other, it was just embryo. It was very early in life. Yeah, it's move on.
So it's
So
the
move on.
equivalent of, you know, if you have ever lost a loved one, death.
It is.
That is what it is.
Yes, I experienced a miscarriage in 2013
No, Paula.
at 4 months. So this is so real to me. And 2013, two of my neighbors, we were pregnant at the same time. To date, when I see their children, I remember my baby would have been
That size, that
stage.
age now.
So it is something that does not go away. It is something that you mourn for a while. And sometimes the biggest challenge I've seen is when the woman or the man keep asking, what did I not do, or what did I do, right or wrong? And so the repercussions that come after the miscarriage are even harder. So I felt really sad when you shared about this lady who was in church and was asked, when are you getting pregnant? Yet she had just lost.
Miscarriage, yeah.
And so miscarriage, the thing about miscarriage is like it doesn't leave a mark unless it was surgical and all such things like ectopic pregnancy, like Dr. will explain. But you have to wake up and still go to the office. You have to wake up and still keep moving. You have to just keep going. Now, speaking from a woman's perspective, most of the time when a woman loses a pregnancy, be it at whatever age, they feel the nurturing aspect of a woman feels like I need ASAP, immediately. I need to get pregnant. Even when a mother loses a child, the first instinct is like, get another child. Replace her with another child.
And yet, from a man's perspective, that might not be
Trauma.
what
He's
we
traumatized,
think is-
especially if there was a lot of pain and bleeding and the man watched. I've had several men who say, I don't want anything to do with that pregnancy again. Yeah.
Miscarriages have also been associated, especially in our African cultures, as you know, with witchcraft. And,
Oh, yes.
you know, like this. There's just so much around it.
Especially like now you listen to that, our viewer says it happens at a certain period.
7 to 9
Do you know
weeks.
you can believe that
Yeah.
there's someone who does something at this?
And because now it opens you up for manipulation and even
Yes.
you'll have no reason
And
but to
connect
believe.
it with the...
And then plants it in your subconscious.
Yes. And so
And once
every
that
time...
has happened,
So every time you're pregnant, when you're just about 7 weeks, you'll start worrying. And so you'll start, getting the trauma that comes with it. And then you might even get stressed enough to just remove the pregnancy.
Yeah, you get another miscarriage.
So what causes miscarriages, Doctor?
Many reasons. I've had quite a number of patients. I had a patient who had miscarried 12 times. She was a sad, sad person. I can imagine. And when I saw her, I think I saw her twice. She came, she gave me her story. And you see, for us, it's very important to know which year that happened, at what stage, how many weeks was it, what happened, did you take medication for the baby to come out, or were you taken to theater to do what is called cleaning of the womb?
It's so painful.
And so on. We need to get those details because they do help us to sort of have an idea what the possible reasons might have been, and also how to plan, for the future. I had a patient who had miscarried 8 times, and again the same, just like that one. Week 7, week 8, week 7, week 8. The biggest, the longest she went was 9 weeks. She came and we did quite a number of tests, which I'll come to in a few minutes. And we even did chromosomal tests. And what we discovered is that the husband had a problem on what we call chromosome, I think number 45. Chromosomes are what is called genetic material.
Yes.
And it's what determines how this baby is going to look like, whether the nose is going to look like the father, the ears are going to look like the mother, and so on. So this gentleman had a problem on chromosome number 45. And what basically it meant is that with that problem, the chances of him having a baby was actually very low. And it would increase the chances of a miscarriage by about 45 to 50 times.
This is from the man?
From the man.
Because remember, in order for us to have a baby, we need the sperm and we need the egg. Now, when, the Bible says that we are wonderfully and fearfully made, we are actually wonderfully and fearfully made, because out of that structure, which you cannot see under microscope, you remember the other session we were talking about sperms, how they swim. Somebody was saying they swim like this. Really, you have to go back.
Even illustrated
how they swim.
I will not rest.
From that structure which we can't see, it actually codes for everything that is going to happen to our body, how we are going to look like, how our structures on the whatever are going to look like, how our nails are going to look. I mean, everything. From that structure which you cannot even see with your naked eye. The same with the egg. So when the sperm fertilizes the egg, what basically happens is that there is an exchange of the genetic material. There's what is called crossing over. So they cross over, they mix and match. So now that is now when the baby comes. First of all, we start with an embryo. On day 1, after the fertilization has occurred, they divide into 2 cells, just 2 cells. And later on, they divide into 4 cells. So they keep on dividing, multiplying by 2, by 2, by 2. And this is now what will decide that these cells will go into forming the eyes. These cells will go into forming the nose, and so on and so forth. Okay? Now, sometimes you may have these cells which are going to form the what you call the sac, and the baby lives inside the sac. So you may have these cells, but then the cells that form the baby itself are not there. So that is where you have that empty sac. So there's a pregnancy. It is actually there, and it is actually growing. The patient will have the same symptoms. Nausea, sometimes vomiting. Sometimes you guys hate us. You don't want to see us in the first week.
It's the chromosomal effect.
The chromosomal effect. But then when we do a scan, we find that, yes, it looks okay. It looks 8 weeks, but by 8 weeks, we must see a baby. Actually, if you have a good machine, 6 weeks, 6+, you should be able to see a heartbeat. But then that baby is not there. That's called an empty sac.
What is there? Like you're saying,
just
the stomach is. No, I'm saying stomach.
The stomach. Translating from Kiswahili,
So outwardly, physically.
Yes.
It's very early, it's very early. So you won't see the abdomen, growing, but you can see. But in some experienced mothers, have very experienced. Atakuangalia kauza Karo uko sawa?
Wanaangalia hapa. They even look at the palm.
Anajua anasema hapa kuna kitu kinaendelea, even if you don't want to admit. So
does the empty sac grow? I've seen someone go up to almost 7 months and still thinking she's pregnant.
Most of the time it doesn't go that far. Why? Because we do scans early.
Oh, this one, of course, these are the ones that don't go for antenatal.
So we do that. Once we've seen that there is no baby and there is no heartbeat, so we recommend come after 2 weeks or so, because by 2 weeks, when it gets to 9 weeks, 10 weeks, we must be able to see a baby.
So it's important to go for antenatal as early as that.
Absolutely, absolutely. Because again, that will help us. You remember she said she's also had an ectopic pregnancy as well. So the first scan that we do, we suggest that we do it as early as possible, around 7 weeks. By 7 weeks, we should be able to see a baby in the right place, that is inside the womb, and we should be able to see a heartbeat. So if you stopped, your last periods were 7 weeks ago, there is no pregnancy in the womb. So the first thing that we worry about is an ectopic pregnancy automatically. While we are thinking, we are looking, trying to find out about other things, make sure that you have ruled out an ectopic pregnancy.
I'm sure Justus doesn't really fully comprehend what an ectopic pregnancy is.
So basically, normally what happens is, once you remember that fertilization has occurred, and that fertilization occurs in the tube.
Yes.
There's a tube. Let's say my body is a womb. My torso is the womb, and my hands are the tubes. Just below the tubes are the ovaries, and the ovaries are the ones which carry the eggs. So every month a woman releases one egg, either on the left side or on the right side. At the end of the tube, we have finger-like projections, which are called fimbria. We are wonderfully made. So what happens is that once ovulation has occurred, an egg is released, and this egg is actually picked up by the fimbria, and it is pushed inside the tube. And that is the time you ladies feel like you must have, intercourse. Because then
we even
ovulation
look
has
like
occurred.
it, and
You look like it, the scent
nice.
is like it, and all that. So once that has occurred and everything is okay, we in one episode we talked about the sperm and the quality. And let's say the sperm quality is okay, the number is fine, the motility is okay, the quality is okay. So the sperm would move through the cervix into the womb. And by the way, the body actually knows which side the sperms are supposed to go to. So it can't be, wacha tuingie tu tutafute.
Our bodies are very smart.
It's a complex.
Very complex. So if the ovulation has occurred from the left side, they'll actually be directed towards the left side, so that they all go through the tube and pass through, and they get to a certain point, and that is where they meet with the egg. So they'll congregate around the egg. Millions of them will circulate around the egg until one of them will actually drill like a small hole and get in. And then when it drills that hole, that sperm has actually something, it has something like a kofia. So it will remove that kofia.
See what you were talking. Like I always imagine the sperms was singing "Hortically." And then they have to hats off, madam. Hats off.
So as soon as that kofia, like the structure, basically just protein, as soon as it is removed like this, the genetic material gets into the egg. Now they start the mixing and matching. That's fertilization has occurred at a particular point in the tube.
All right.
Now, once that has occurred, the tube has very fine hairs, and it produces a little amount of fluid. The purpose of that is for that baby now, because we call it an embryo, to start sliding back. And it's pushed very gently. As it is sliding back, it is divide, such that by the time it gets to day 5, it has reached where? It has reached the womb, which is ready, waiting. And when it gets there, there's a lot of what we call signaling, biochemical signaling, which appear, which go on, and it will get to a point, again, it will drill a small hole, release a little bit of acid, by the way. It drills a small hole, and it will attach itself. And that attaching itself is basically their vessels, blood vessels there. Inashikilia hapo. So ikisha shikilia hapo, you will not have a period because now there is a baby living you there. Okay, so you'll miss that period. 4 weeks, sijapata period. When was my last period? 5 weeks ago. And then you're just feeling, oh God, yeah. Wengine wanaanza kutema mate, and then you say, let me check.
There's some very good sleep that
very good sleep. So when you check that, you find the two white, lines, like, blue lines or whatever. So you go to your guy, and your guy looks like, why is she being so excited? Most of the time in a
yeah.
So basically now, those two lines, what basically happens shows you are pregnant because there's a hormone that is released.
Yes.
Okay?
Yes.
And this is what is actually released, and it shows that this pregnancy is doing well.
Yes.
Now, in an ectopic pregnancy, what happens is that fertilization occurs, it starts dividing and going, but then it doesn't reach the womb. It gets either somewhere a few centimeters from where the fertilization occurred, it gets stuck there. Kwa sababu gani? Most of the time you find either the womb, the tube has a problem. It is either stuck somewhere or there's something that happened with the tube. So that movement does not get actually, the embryo does not get into the womb. So it gets stuck, it drills that hole and gets stuck and starts growing. That is an ectopic pregnancy. And it can happen either in the tube. Most of the time it happens in the tube. However, it can also happen in the, what you call the myometrium itself. So instead of it getting into the womb itself, it gets into the muscle itself. Sometimes it can happen in the cervix, very rare and very, very dangerous because of the bleeding and so on.
So when that happens, what do you do?
When that happens, we have to take this patient for surgery most of the time. But again, it depends on how soon we have caught it. If we have caught it very early, we can actually give this patient medications, give an injection, and then repeat it after some time and see those levels. You remember about that hormone which I mentioned? See how those levels are decreasing.
But basically, you lose the pregnancy.
Very, very rarely does it go to term. Actually, last year, was it in somewhere October, November, I did surgery on an ectopic pregnancy, which was in the abdomen, which was 35 weeks. It's very rare, very, very rare. Yeah, and we managed to get the baby out, and the baby went home after a week with the mom.
Wow.
Very rare, very, very rare.
That's a very rare.
Very, very. Maybe one day we'll talk about it.
I know, but you make every time you're teaching us, and I think you are more of a teacher than a doctor. I'm fascinated by how wonderful and beautifully we have been created, and how lack of information leads us to even hurriedly making some decisions.
Yes.
That were not, that end up complicating the whole thing. Misinformation is power. We are happy to have you in our generation.
Thank you.
Yes, and we are happy that we're actually documenting this for the generations to come.
Yes, I'm still imagining how the sperms dance for the org. Okay, so and then you see God in His own sense of humor, like the heart has to come down. I feel so honored. I feel like,
I have a very clear understanding of ectopic pregnancy now than before getting here.
And now we understand why it's dangerous. You see, now a woman now understands that it cannot grow.
It cannot grow, and then it attaches itself to a vessel.
There are the vessels.
There are vessels there, tube which supply the tube, and they drill into the vessel.
Yes.
So that is why the bleeding starts.
Yes.
Okay.
Yes.
So that is one. And now what is happening when this other process has gone on normally, all the way to the womb, and everything looks okay until week 8, week 7, week 9, and then.
Now, there are actually very many reasons for miscarriages. It has been proven that 40 to almost sometimes 60% of pregnancies, even first-time pregnancies, actually end up in miscarriages, unfortunately. And there are very many reasons for that. For example, one of the reasons can be that fertilization occurred, but then the embryo has a problem. And nature has a way of getting rid of anything that is not normal. Or rather, most of the things that are not normal. So if that baby, that embryo is abnormal, it will not stick. Or if it does implant itself, it will grow to a certain level, a certain week, and then nature will get rid of it. There's an inbuilt mechanism. I remember a case we had in the UK. This lady, a young lady of 43, 44, came for IVF. When we did her, her hormone tests, they were perfect. You'd never think that she's a 43-year-old lady. Her ovarian reserve was very good.
Very good.
So we did IVF and we got very many eggs. And the embryos that we got were beautiful. And we were like, maybe this one has cheated nature. So we did a transfer and she actually got pregnant. The first time, bang, she got pregnant. And we were like, well, let's wait and see. And she got pregnant, everything was fine, and she reached to 9 weeks. The heartbeat stopped. So normally, we normally don't check, because if there's a miscarriage, we normally are supposed to check whether that baby was okay chromosomally. But because of her age, we had to do the test, and we found that the baby had chromosomal issues. So she came back again because we had frozen embryos which we had kept, and we did it the second time, and she got pregnant again, and she went to 9 weeks again. It also did the same thing. She had chromosomal issues. So in as much as we may think that she had cheated nature, she had actually not cheated nature. As we grow older, the eggs grow older,
the body
and
takes count,
we'll have issues. Coming back to our patient who had she was the 7th pregnancy. Some of the reasons of miscarriage are, number one, can be because of that. There are issues with the chromosomes. So in such a case, when we see recurrent miscarriages like those ones, we want to do a blood test to check whether the chromosomes are okay from her side and from her husband's side. That's one. There can be issues with blood sugar. Very, very important. Blood sugar is okay, but if it crosses a certain level, it becomes toxic to the baby. And you will lose these babies very, very early. And I had a case some time ago where this patient actually could not get pregnant for many years. We did what is called a hysteroscopy. She had a growth in the womb. And I removed that growth and she became pregnant. The first time after, I think, 14 years. So when she became pregnant, she carried the baby to 8 weeks.
The baby.
She had a miscarriage. Because she had been encouraged, now that I've got pregnant, she went back again and did another IVF cycle. She carried the baby to 10 weeks this time. Again, the same thing. She went back again and did another one. This was, I think, her 13th or 14th IVF cycle. She got twins. And of course, now whoever was taking care of her, of course, everything is fine. She went to 10 weeks. She lost them. She lost the babies. So the person who was taking care of her said, you know what, let's just check and see. Maybe let's just take the sugar. Her sugar level was, I think, 18 millimoles per liter, whereas the cutoff is 5.5, 5.8. So she was diabetic, but she didn't know. So she continued losing these babies because of what? Because of the high sugars. You may have issues with your clotting, for example. Clotting is very, very important. In order for that baby to grow, you remember they drilled like a small hole, attached itself. The baby needs to get very good blood supply, because the blood supply will bring oxygen and nutrients. So if you find there are micro clots, tiny clots, you will find that that blood supply is not sufficient. So not get enough nutrients, enough oxygen, and so on. And even enough hormones as well, because these hormones come from the mother as well. So you find that it will reach a certain age and it'll come out. If there is a problem with the womb, that the womb, for example, sometimes can be divided into two. So it may stick in one, or it may stick somewhere in the middle. It will grow, and then it reaches a place where it can't grow any longer. It will come out. You may have issues with hormones. You remember there's a time we talked about thyroid stimulating hormone, prolactin, and so on. So if the thyroid gland is not functioning the way it should, and sometimes it may have what you call antibodies, it will also have a problem. She'll get pregnant, she will lose it. Infectious diseases, and these infectious diseases can be very many. They can be viral, they can be bacterial, and they can also include urinary tract infections. Sometimes they are non-specific or there are those which are not very common. They can also affect. If you have, other diseases, for example, HIV and so on, it can also lead to that. You may also have other issues as well, because when you look at our body is made of cells. So every organ has cells. So the cell structure itself is created by membranes, and in those membranes there are what we call different proteins. So if you have something called antiphospholipid syndrome, phospholipids are basically proteins which help in the normal functioning of the cell. So if an antibody is something which is against, okay, so it's like soldiers. We have Kenya Army. Kenya Army will be against any foreigner which comes to attack us, not from within. So if you have foreigners coming to attack the body will produce, what you call antibodies. But sometimes the body will produce antibodies against itself, like what you call autoimmune diseases. So if there are autoimmune diseases, for example, rheumatoid arthritis, for example, and so on, and this is antiphospholipid syndrome, then the same thing will happen. You get pregnant, reaches a certain level. If the immune system is not working well, and the immune system is very, very complex, because remember, we got sperm from a foreigner who is a man, and the eggs are yours. So this structure which is being formed, this baby, is actually a foreigner.
Yeah, it's a foreigner.
Because it has sperms from somewhere. So the body, in order for the pregnancy to actually attach and for it to grow, it has to be accepted by the immune system. So if the immune system doesn't accept that foreigner,
what would lead to the lack of acceptance?
Many things. For example, if the blood group is different, if, for example, your blood group is positive and your wife's blood group is negative, and then the baby that is formed has your blood group. So your wife's body will realize, Apana, this one is not part of me, is not part of us. So let's attack. So they to produce antibodies.
Is that what the rhesus factor
that is the rhesus factor, for example. And then there are so many other things. There's trauma as well. There are issues with chromosomes, which I mentioned, and so on. So in such a case where you have 7 miscarriages, there is definitely a problem.
There's something.
There is definitely a problem.
And we are saying these are not things that you'll be able to deduce by yourself.
No, you can't. You can't. These are issues which need to be checked out by an expert, somebody who will sit down and listen, take your story very, very clearly, first of all, and then think through what you have gone through, and then try and find a way of actually asking for tests which are pertinent and which will sort of direct the way of the way.
Do you know what is frustrating, Caro, even before you come in? Because this is someone who most likely has been going through the hands of a medical, expert, the gyna, and for them to have done that 7 different times.
They should have seen something.
So actually you should say, you know what? Take a step back. Please don't try to get pregnant again. Let's take a step back. Let's try and find out what the problem is before you even try to have another baby again. So we do the whole palette of tests that we need to. Maybe expensive, and it's going to be expensive, but it's good to get to the bottom of it. And then the other thing is once you get 2 miscarriages, and then you say 3 miscarriages, we would like actually to do this. We get the baby out surgically. We remove the baby. We send that tissue for analysis to see whether there are any chromosomal issues, because then that would give us an idea. We say there's a chromosome, there are issues here which have chromosomal issues, and if they're there, how can we sort of mitigate? How can you prevent them in the future?
The question I have is, we've talked about all these very enlightening things. The only thing that I would want to understand is how to test the clotting. The rest, at least the hormones, we know we can check the hormones, the blood test, the rhesus factor. Which test helps you know if there is a problem with clotting?
It's coagulation. It's called a coagulation test.
Okay.
Yeah, it's just
That's
a
the
blood
normal,
test.
The
Yeah,
normal
just a blood
coagulation
test.
test.
Yeah, it's a blood test and the other for a coagulation test.
Okay.
Yeah.
Wow, that's enlightening. At least now there's even hope. Like I'm listening on behalf of the viewer, and I'm thinking, you are seated there, maybe even thinking witchcraft. You're thinking, I don't know what. Or you are even blaming this and the other, yet maybe it could be something that it is not your fault. And I told you one of the things that someone struggles with, even a man. I keep insisting that men should talk about miscarriage because it really affects them.
Yeah.
It really, truly affects them. And they don't know how to handle their own emotions and the emotions of the woman after they've lost the baby.
We are not very good at handling emotions.
Yes, you have no idea how to handle the woman. And then immediately remember, and it's very important that you've said that, and our viewer will understand, your body is not ready for another baby. Stop running immediately without getting to know what the problem is. But that is defying nature. I told you the moment the baby comes out, you just want to replace the baby.
It was very simply put until it made a lot of sense that the body will always,
it knows,
like expel whatever is not normal.
What is not normal.
And so when that happens, then it's actually an indicator. The body is telling you that there's something that needs to be fixed
before you bring in this foreigner. And the body, I have a very wild imagination. I keep imagining that there are so many doctors in our immune system. There are those old guys with very white dust coats with big glasses who are always taking count and saying, this guy, last month they gave us this. Now they have brought again. Let us dispense this thing. So they will keep doing that until it's the same thing with virus and bacteria. They will study and see all the components. So for a woman now, this is a personal decision that you have to make. It doesn't matter what the urge is. You have to resist it until you get to know what exactly the problem is. Otherwise, you will not be able to save yourself from the pain and the desperation and the anger that comes with it. Because what happens is if you keep losing these pregnancies, you will start loathing yourself. You will start wondering. You will even hate your body that is refusing to carry the pregnancy. And yet maybe it's something that could have been corrected, or it's something that you have nothing to do with it. Now that also helps the man understand that sometimes even the problem could be him.
Yes, that is why that is why they should come together as a package, and we look at both of them. Both of them.
Yes.
Of course, most of the tests will be on the woman's side.
Yes.
The man's side will give us blood, because if she's been getting pregnant, then it means
at least
that
there's conception.
The sperm is okay.
Yes.
So it could be something now which is inside the sperm itself, possibly.
Yes.
So that is why for him it will be just a blood test. And now for the bulk of the test will actually be on the lady's side.
So the man who is watching should also be a support system to this woman. And I hope there's a mother-in-law watching. I really hope there's a mother-in-law watching and sisters-in-law who will keep blaming this girl, because miscarriage is not simply as simple as we put it.
No.
However, I've noticed of all the causes that you have mentioned, they can be triggered by our lifestyle in one way or the other, except now the chromosomal one and the other one for that one. If, for example, I am under so much stress, it will interfere with my hormones, which will interfere with the pregnancy.
It will interfere with the immune system, first of all.
It will interfere with the immune system, which will... So it is also very important to look at how are you handling it. I've watched women who got pregnant when they were not ready, and because of the amount of stress that they had, the body just said, okay, you don't want this baby, let it come out.
Or even something happens, something drastic happens, an event happens, happens which shocks you.
Yes.
And then what happens is that, like, I've started bleeding, and or you start having contractions, and you end up losing the baby. You get information that, for example, somebody very close to you has had a major accident or has passed away, and it is something which is, so that stress itself can also lead to
Now
miscarriage.
I've also
and something else just before maybe before we go, we talked about fibroids. You remember in one of the episodes? That is also one of the issues again, which is very, very important. That is why now when it comes to looking at this woman, we really have to look at her 360 degrees, to everything.
Okay, I'm really also wishing that our nurses, our midwives, our doctors are watching. Because you are calmly, in very professional ways, telling them it is important that when a woman comes when she's pregnant, it is important to see it all round instead of seeing it like
and
this.
sometimes even to also just advise, because sometimes doctors only respond to that which a request that the patient has made. If the patient does not call for a specific test, the doctor is, doesn't take any initiative, and sometimes the patients don't know any better.
They have no idea. They just had someone saying something.
And that is why that history is important.
It's important.
So that we sort of have a bird's eye view about what is happening. I think we haven't talked about nutrition, and that is also very important. It's also on your beat now. So if nutrition is not okay, then there are going to be issues as well. You have patients who are anemic, and if they are anemic, the baby will not get enough blood supply, enough nutrition. Again, you find we come back to the same thing.
Yes, because I'm looking at the one that you've just talked about, the sugars. And I assume this woman is pregnant, she doesn't go for antenatal clinic, she doesn't check the sugar, she doesn't check the blood pressure. And or you go to that antenatal clinic, and when the doctor asks you for the blood sugars, and you're wondering, where is my blood sugar coming with my pregnancy? Yet your body can be hiding some other things that you don't know. So it's very important also as a patient, from the patient and from the nurse or whoever is taking care of the patient, to look at all the angles. I think we should have, now that you are the chairman of the Kenya Gynaecologists, should have like a fixed guideline. Because this now I'm speaking as a villager who comes from that village, who I have seen even women being told, go away. Personally, when I was pregnant, I used to go for antenatal in my village. I'm not saying my village is bad, but some of the things you are even seeing and the things I've interacted with, I never knew what they were because no one really bothered.
And some of these basic tests, as you talked about guidelines, we do have guidelines.
It's only that they refuse to follow.
Not necessarily, because when nowadays we have this antenatal booklet, which is actually a fantastic tool. Fantastic tool, and the patient comes and everything is recorded there. She came on 22nd of April. Her blood pressure was so and so, was so much. Her weight was, and the baby was tested. That sort of thing. But right at the beginning, there is a battery of tests which every woman must have done. We want her what we call triple serology, that is the HIV status. We want to check whether hepatitis is there, that is hepatitis infection of the liver, because this, if it is there, it can be transmitted to the baby, that sort of it. And if we know it is there, then we know how to deal with it during pregnancy. We want to check whether there is syphilis, because syphilis can also be transmitted to the baby, and so on. So that is basic. We want to know her HB, that is how much her blood level, because of anemia. And anemia is one of the biggest problems in this country. It has a lot of issues later on. Talk about miscarriages, talk about premature deliveries, talk about postpartum hemorrhage, talk about delivering small babies, talk about even death of the patient itself. So we want to know that HB right at the beginning. We want to know whether she's had any other diseases as well in the past. We also do a urinalysis as well. Sugar is one of them that we do. But is it possible to do all of them in that health center where that midwife is, sometimes it is not possible because there are no reagents, and so on. So in as much as, yes, the midwives know what to do,
they don't
sometimes they may not have the equipment to do it.
Okay.
So that is another challenge altogether.
Okay.
But there are guidelines by, we are supposed to do this, we are supposed to do this. All this is there. 28, 30 weeks, they're supposed to do what is called an OGTT test, oral glucose tolerance test, so that we know whether she has, gestational diabetes or not. All these things are there. But sometimes we are hampered by the equipment.
Okay.
Yes.
So
I think that's why this thing, everyone has to come on board.
Thank
the government
you.
has to.
Absolutely.
We cannot.
Actually, the next time I'm visiting my village, I'll go and see what is available.
Go and see what is available. Then you can even talk to your MP and say, Allah, can you make noise for us to get to this stuff?
And also maybe that is why we are having so many so many deaths caused during pregnancy because of the gestational hypertension and diabetes, which we will talk about. And it's because of access. So access is not in somewhere in some village. It is even in our local villages. But okay.
I liked one thing you said, and because as we figure out even solutions, and the more we talk about it, the more we realize the solutions are with us.
Just here.
Within us. But because we've not had conversations around it, we don't even stop to imagine that a solution could be around us.
Absolutely.
And I liked what you said, even for those who are getting into relationships. These are conversations you should have prior. So that you begin to anticipate things.
Yes, what happens if you find I cannot be able to carry a baby? Or I don't have a womb? Because there are cases like that.
Or it is double.
Or it is double. Or you find the sperms are not there. We should have, when they go for that counseling, it
should be one of the it should be one of the requirements. And speaking of solutions, we've just talked about anemia, and it is one of the things that is affecting so many people. I have done a lot of research on how we can use indigenous foods, and I have 3 specific plants that I use. I have made a tea from Mexican marigold, blackjack, and dandelion. Tried and tested on myself because when I was going after my surgery, after hysterectomy, my HB was always 19 and above. It's my mother who used to give me, to a point my doctor asked me, what are you doing? So it is that one I borrowed from my mother. I took the information, I took it to the lab, and I checked, and it is able to give back the blood in the right quantities in a very short time period.
How short time period? How?
Maximum 2 weeks.
Maximum 2 weeks. See, I can try that tea myself.
Yes, you need to. You need to. That is one of the things I have. Not? It's a tea. I think I'll serve you next. But it's a tea that is.
So you take it. You take it every day, or the patients take it every day?
Yes, you can take it every day. Yes, even myself, I have made it a tradition. I have to take 2 cups of every day.
Okay. Yes. That's interesting.
Yes. And at the same time, it detoxifies your tummy. Just keeps you happy, but your HB will always be good.
Blackjack, you say it?
It's blackjack, dandelion, and Mexican marigold.
Blackjack actually is used by other societies for hypertension.
Yes.
Yeah.
Yes.
Yeah.
And dandelion is one of the most powerful herbs that we use a lot. I know,
because
it is causing all these problems.
Sticking on your clothes.
What is this
and
thing?
Mexican marigold, we were told if you give a cow, it will go crazy because it smells really bad.
Yes.
But yeah, that is my mother. I borrowed that.
We've grown
from my
around
mother.
actually a lot of natural remedies and solutions.
We have them.
The conversation on miscarriages, I think you've shed a lot of light. And someone who didn't know where they are or what to do next, I think what we have shared should be something that can at least give them a head start on what next to what step to take next. I just wanted to read. I know we have answered a lot of what she was asking, but at least to also recognize that there were so many other people who made inquiries on this.
Yes.
This one says, and speaks mostly to the social stigma and all that. I no longer have friends. I walk facing down. Every time I walk past people, I feel like they are talking about my infertility. I got married in 2019 while pregnant. So infertility here is used in quotes. Got married in 2019 while pregnant, but lost it 11 weeks. Lost it at 11 weeks. So I had back-to-back miscarriages, and doctors didn't help much. Fast forward, the whole of 2022, I didn't conceive and was not on any family planning. I was asked to go for HSG, which almost made me mad.
It's a horrible
It's
Yeah.
test, by
painful,
the way.
yeah.
Some said my only hope is IVF. I took so many things, and she mentions them: Chinese teas, Kalenjin herbs, dieting for a year. You know, so she says 2024 March, I repeated the HSG, and right tube is completely open, while the left still blocked. I somehow had hopes. My cycle is always 28 to 30 days, but now I'm on cycle day 38 with the negative tests. My body is playing tricks on me. I really have hopes that one tube will give me my miracle. Now I don't understand what's going on. What do I do at this point? My husband is very supportive, but I know deep down he wishes he could have a baby soonest.
And again, because we don't talk about it, we keep quiet.
Yes,
you see
we
the way
keep quiet,
my husband is very supportive, but anakufa kiofisa, you know, that sort of thing. I think she has several things which need to be looked into. The fact that when she walks with her head down, and whenever she passes anybody, says they are talking about my infertility. So I think there are serious psychological issues. She will need some therapy.
Yes.
Definitely.
Yes.
Because I think that is really weighing her down. That is number one. Number two, she did an HSG which was horrible and showed that both her tubes were blocked. But we need to know at what level they were blocked, because the tube can be blocked right at the joint here, or it can be blocked midway, it can be blocked right at the end, and so on. And then she took all those things, Chinese tea, Kalenjin tea, whatever, and she went on what for 1 year? On diet for 1 year,
diet
and
for
so
a
on.
year.
So it just goes to show the desperation that a woman who wants to have a baby will actually do practically anything to try and have that pregnancy. Others go even as far as saying, let me be pregnant and lose that pregnancy.
Yes.
But I know that I can also do what? I can also get pregnant. So she does another HSG, and one of the tubes is okay. That was on the right one, I think. The right tube is open. Sometimes it does happen that way. By the way, most of the reasons for blocked tubes, most of the time is infections. And these infections are quiet infections.
Yes.
The patient does not know that she has an infection. It's only later on she's trying, for so long to have a baby. It hasn't happened. When you do an HSG, we find that the tubes are blocked. Surgery can also be another reason, especially if the surgery is in the pelvis or in the lower abdomen, as it were. And when the healing process starts, sometimes the organs can start sticking to each other, what we call adhesions. That can also lead to blocked tubes. If she has one tube blocked, there are two things here that we don't know. We don't know her age, number one. We also don't know how her partner is, the partner's sperm. We also don't know her hormones, how they look like. So assuming that everything is okay, the partner is okay, the husband is okay, her hormone levels are okay, and her age is not a factor, yes, it is possible for her to get pregnant even with one tube. The only thing is that, remember, if it is one tube only, her fertility has already dropped by 50%. So we only have to rely on that right side. So we need to monitor her during the cycle. If the periods are okay, she said there her periods are regular, 28-day cycle. So around day 10, day 11, we need to do a scan and see where the egg is going to come from. If it's going to come from the left side, there's nothing that we can do. If it's going to come from the right side, then we can actually give her an injection and then do two things. Tell her that once you've given you this injection, we have a window between 24 and 36 hours where they need to have intercourse. Okay, because we know for sure ovulation is going to occur. So have intercourse during that window when we know that we have the highest chances of getting pregnant. The other option would be do the same, monitor her and give her that injection, and then the husband can come and give us a sample. We clean it, and then we do what is called intrauterine insemination. So we clean the sample, and then we send the sperms now through the cervix straight into the womb, shortens the distance. We remove all the sperms which are not okay. We only leave the very good ones. So that also increases the chances of her getting pregnant. So there is hope. Now, day 38, and she still hasn't had a period, and we have a negative pregnancy test. She needs to see a doctor. We do a scan. We try and find out what is happening. Yes.
Oh.
Yeah, I feel better. You know, sometimes when you read those concerns, they also weigh you down when you are helpless and you're, you know, imagining, is there hope for this one? And then when Daktari explains it this way.
I told you when you talk to him when you're infertile, you feel like yes, I'm ready for it, because I think when you don't have information, everything is a mountain.
It's a huge
it's a mountain until when the information comes and it breaks it down, and you're like, oh, it was not that bad.
Thank you. Thank you so much, Daktari, Dr. Kireki Omanwa.
Karibu sana.
Remember, you can visit him, you can reach out to him. He will give you all the contact details. You can visit his clinic. He is a man of many things. He is a lecturer at the University of Nairobi. He is the president of COGS. COGS in full is what, Daktari?
Kenyan Obstetrical and Gynaecological Society.
There you have it. So he's a man who knows what he's talking about. And I've had actually a lot of your, patients or clients who, have very good reviews of, what you do, because most of those I've talked to don't just look at you as a doctor. Because there's a way the doctor-patient relationship that is very
strict.
But you go beyond, to try and really understand, dig into the history, and you're doing an amazing job.
Thank you.
Caro, I think you have become a household name now, and many people now find hope because you have opened up a space, where people can feel safe enough to talk about things that ordinarily we wouldn't even open our mouth, and especially articulating some of them even in their own local dialects. You have created that safe space that make it very practical for Daktari to actually even now have, people coming to him. So both of you are doing an amazing job. I celebrate you, and I pray that what we are doing here may indeed contribute to that general well-being of our society. And we are promised of a better generation to come, and even those that have issues that need to be sorted now. There's hope.
Yes, there is.
Yeah.
There is hope.
Wow. Our time is fast spent. Closing up, as you tell us how we can be able to reach you. Any final thoughts? Then we end the show.
Oh, wow. Yeah. Okay, thank you so much. This platform is always enlightening. I look forward to the days that we are doing these shoots. What maybe our audience don't know is that even behind the camera, the conversations continue and they are very interesting. I think one of these days, Gidi should do behind the scenes and just catch us when we are having these conversations, because they are real. Then I've found friendships in this platform, and it has made me grow in so many different ways. And our audience, thank you. Thank you so much, because it's because of you that we keep coming back. It's because of your questions, your concerns, and you trusting us that we keep coming back. For you who is struggling with miscarriages, even as we do the medical, the nutrition, the everything, the first stage is the psychological. You are mourning, you are grieving, and you need some space. You need some help. It is okay to ask for help. It is okay to go through grief. It is okay to go through it, and so that you can be able to heal the wounds that come with it. So you are not alone. There are quite a number, and if you would like to share with us, I'm sure it is open. Our channels are open. Sometimes we share. There's the first time I met Justus, and he told me to share my story, which I had refused to share for so long. He told me, you don't share your story for selfish reasons. You have to allow yourself to tell your most authentic story for someone else. You never know. You just never know who else you will touch. I am a naturopathic health coach. I'll help you with nutrition. I'll help you with psychological support system, social support system, as Daktari helps you with the medical support system, as you are going through the miscarriages, and as we prevent more miscarriages and any other sexual and reproductive health related issues. And I work under a company called Rejuvenating Nature's Beam. I am in Thika Town, headquarters, Section 9, just before Chania Tourist Lodge, and also in Hurlingham, a mezzanine Titan complex on Chaka Road, mezzanine. And I have different shops in different places. If you would want to try my tea, I actually want to gift this show the 10 of my teas for the HB, but specifically for the people with HB issues, so that we can help someone boost their blood. This is a gift I received from my own mother, and I have only added the research to just conclude the whole journey. And so I would be happy to give to someone, and then I'll put some in Daktari's office and some in your office.
Maybe
and
we should also ask those who would be interested in and then we can pick from our audience and also gift a few of them as we encourage the rest to
because it's sad to hear that anemia is one of the big problems we are having. Yet we have these answers. Yet we have our vegetables. We have all these things. It feels really sad when I hear that anemia is giving us such a problem. So if you would like to call, our office number is 0711 621563, 0711 621563, or you can go to all my social media handles, Carol, your health coach.
Very good. Thank you so much, Carol.
Karibu.
Daktari.
Thank you so much for this platform. It's always a joy to discuss the problems that are out there, and obviously the solutions that we offer. The patients who've had issues with miscarriages, don't lose hope. There is hope. We will try and help you. God willing, it's God who gives. It's our God who gives us this knowledge. So we will apply it as much as possible in order for us to help you. And you're welcome. My office, I'm located at 5th Avenue offices, which is off Ngong Road, on the 3rd floor, room number 314. And my office line is 0780 170 170. Asante sana.
Karibu sana.
Thank you.
And we call it a wrap?
Yes.
Yeah, I end the show with a smile. Thank you so much. Make sure you subscribe and follow this content. Share as much as you can. See you again next time on the Reproductive Health Conversations.